Yeah, risk management. I kind of was lucky enough to fall or jump into risk management. So I was a custodian at a hospital, then got a job as an orderly on the orthopedic unit at that same hospital. From there, I went to PTA and got a degree as a PTA and worked as a PTA for about 5 years. And then went back for my bachelor's and my DPT, had kind of a bridge program there. So then after I got out, I worked some outpatient manual therapy, really kind of dove headfirst into that. Anything I can get my hands on in terms of extra knowledge, really manual therapy stuff. I tried to kind of briefly open my own cash-based practice working with golfers. That was short-lived as I was about to have a baby and needed some more income and some stability in terms of health insurance.
This episode is brought to you by PT Pintcast Media. If you've ever thought about launching a podcast to grow your brand, your clinic, your business, we can help. Email me right now at jimmy@ptpintcast.com. Today's guest, well, before he was helping physical therapy clinics stay protected from high-dollar lawsuits, policy gaps, and expensive oversights, he was a treating physical therapist working shoulder to shoulder with his dad, a PTA. But Mike leaned into the profession in a different way and eventually took what he learned from protecting major healthcare systems and is now flipping the script to help smaller clinics build bulletproof risk strategies without needing a hospital-sized legal department. Today, he's here to help you see that your biggest liability might also be your biggest opportunity. Let's talk risk, revenue, and the upside of being a little bit paranoid. Welcome, Michael Uzar, to PT Pintcast. Well, Mike, welcome to the show, man. Appreciate this.
Yeah, thank you for having me. It's awesome.
I've got a weird background, right? Radio broadcaster to PT, now whatever it is the hell I do in healthcare. You've got a different background too. Maybe not radio, but you were a physical therapist and then you did something else. What is it? What was it?
Yeah, risk management. I kind of was lucky enough to fall or jump into risk management. I guess I can give you kind of the quick and dirty on my background, going way back, but going quick through it. I was a custodian at a hospital, then got a job as an orderly on the orthopedic unit at that same hospital. From there, I went to PTA and got a degree as a PTA and worked as a PTA for about 5 years. And then went back for my bachelor's and my DPT, had kind of a bridge program there. So then after I got out, I worked some outpatient manual therapy, really kind of dove headfirst into that. Anything I can get my hands on in terms of extra knowledge, really manual therapy stuff. Really was into that. I tried to kind of briefly open my own cash-based practice working with golfers. That was short-lived as I was about to have a baby and needed some more income and some stability in terms of health insurance. That was kind of a tricky time for me. So then from there, I worked in kind of a myriad of skilled nursing facility and home health. And while working for a large health system in the visiting nurse, the home health agency, I kind of just stumbled across a job posting, and it looked interesting, but I didn't really know what the heck it was. I just knew that all the things that were in the job description were kind of interesting to me, and being on different committees and working to protect the organization in terms of risk management. So I kind of took a shot in the dark and applied, and I think I just got lucky. That I remember they had reached out and said, "Hey, we know you don't have experience, but we think you got transferable skills. So would you like to take the job?" And from there, I kind of dove in head first, learning more and more.
Man, you like school and changing and things that sort of interest you. You use that word jump or dove a few times. It looks like many people might just say, well, I'm just going to stay in this little area and I'll progress that way. But you had no problem saying, I'm going to do this and then I'm going to leave that little security area, that little security blanket. I'm going to go over here. That's unique.
Yeah, I think you got to kind of, I think I've always been open to different opportunities, right? Take the different opportunities as they come, even if it's in the clinical realm, right? Even if you haven't,
Sure.
I remember you have opportunity to observe a surgery, or because being able to have those stories as you go through and those experiences as you go throughout your career, even if you're just staying, in outpatient orthopedics or in home care, but jumping on those opportunities to be able to experience other things, and you never really know where it's going to take you. So I think that's important.
So you looked at the job posting for risk management. You didn't really understand it. I don't understand
Yeah.
it either. So
Yeah.
how would you describe it now that that's what you're doing?
It's such a great point because I think even when I was working in risk management, I was like, I had kind of a mentor and I'm like 3 months in. And I remember saying, hey, how would you describe risk management to
Yeah.
someone if you were on the elevator with them and you had to, tell them what it was before you got off the elevator? And I didn't really get a good response then either. But I think if I were to explain it to someone now, I would say it's kind of all the things that protects an organization from loss. And when I say loss, most of the time we're talking professional liability risk, things you could get sued for, or you could have licensure issues. But really, we're looking at all types of loss: financial, people, as in your staff, or your reputation. So that's kind of the way I look at it when we're talking about risk management for rehab clinics.
Are you still stuck spending hours on administrative tasks? Empower EMR automates scheduling, billing, and documentation so you can actually focus on your patients, not your paperwork. Book a free demo now at empoweremr.com. All right, so most practice owners don't think about risk until, unfortunately, it's too late. What are some of the hidden risks that you see most often that maybe people are overlooking or thinking that they're not risks when in fact they are?
Yeah, it's a good question. I think sometimes as simple as the way you're managing your patients, because the reputation, especially for some of these small clinics that are, embedded in the community, it's really important. So uh, training and having a process for how you're going to deal with when things go wrong and how you're going to communicate that to the patients, even as much as what is the front office staff going to say or do in those situations, because really those sometimes are the main points of contact. It might not even be that physical therapist who's been working with the patient in those off times of contact, which are really important. I think other things too is a lot of times PTs always kind of want to help. Rehab staff, they always kind of want to help. Front office staff want to help. So releasing information tends to be an issue sometimes. If you're giving a copy of that most recent note to someone who might or maybe shouldn't be privy to that under HIPAA. The other thing is like communication or informed consent for doing certain treatments. I mean, as the scope of physical therapy expands, I think we're going to be getting into doing some things that maybe a little bit riskier. Not to say that they are, and I know that it's very rare that there are complications in a lot of these things. But as we get into doing more things like pelvic health or dry needling, I'm imagining that the scope is probably going to expand. I know in states like Utah, ordering imaging, things like that. As we expand, there's definitely more opportunities for risk there. So having those policies and processes that are embedded in your clinic so everyone knows what to do in these situations.
Yeah, understood. You've got sort of a hot take, and you said that problems could actually be your best and greatest opportunity. What do you mean by that?
I think they are. I think if well, let's put it this way: the some of the larger organizations, they look at things that go wrong and they call them opportunities.
Sure.
And if on a micro level, in some of the smaller clinics and practices, if you can adopt that, if a clinic can adopt that approach of when things don't go right, or you have a poor outcome, or you have a complaint, or whatever it may be that isn't going well, if you really look at that immediately as an opportunity for your clinicians to collaborate and put their heads together on where there's opportunity to improve, but also as an opportunity to strengthen a relationship with a patient. So I'll give you kind of a quick story that sticks out to me a little bit. I'm out to dinner with my wife. This is probably 8 years ago at this point, and sit down for dinner. Really nice restaurant. Order a cup of soup. I think it was a pumpkin bisque. I took like 2 bites of it, and I'm like, man, this is really just not that good. And it was a good restaurant. Probably 2-3 minutes later, the waiter comes out and he's like, hey, you know what? That we just tried the pumpkin bisque in the back, whether this is true or not, but I didn't make a stink about it or anything. I don't know how we would have known this. And he said, we're going to take that off your bill. This is like mid dinner. And that just really stuck out at me as being like, man, that is really good service. And I think if we look in our PT clinics at those opportunities where we have dissatisfied patients, that dissatisfied patient is going to be the most vocal. And the
Sure.
patient who's not heard is going to be even more vocal, and they're going to find
Sure.
ways to get heard. So they might want to get heard by putting in a review on Google. They might want to get heard by posting in the local town forum or by telling 5 friends about how bad that experience is.
Sure.
So I think overall, if we treat those as opportunities to engage a patient, to own where we have, maybe opportunities for improvement or had a gap in the care, we have a big opportunity to strengthen that relationship, because patients know things are going to go wrong.
Sure.
But when you cover it up or you run from it or they don't hear from you for 2 weeks, I think so. So I think if the clinic adapts the approach of look at these things that go wrong as immediate ways to intervene and an opportunity to strengthen a relationship, I think it can have big impact.
Yeah. How could someone who maybe is smaller than the organizations that you work with, right? Like a smaller clinic, 1, 2, couple clinicians, how could they start building a real risk management plan, an outline, something, especially if they're still growing? What would you suggest there?
Yeah, absolutely. I think, well, I don't want to put like a little shameless plug out, but I got a digital product that's a risk assessment for specifically for small clinics that should be coming out in a week or two. But I think what they should look at is all of their standard processes, the things that they do the most. So from the front of the clinic, how they engage with that patient who first walks in. Do they have a process for that intake so that it goes smoothly for the client themselves? And then look at things that are sometimes high risk. Like, if you're doing intimate exams in or pelvic health physical therapy, do you have a chaperone policy? Do you have a process for if someone asks, if a workers' comp or a doctor asks you to write a letter on this patient, do you have a process for how you're going to have that letter written and release that information? So I think just having a structure. If a patient makes a complaint, what are you going to do with that? I think you should really, the front office staff, the PTs, and the clinic owners should really have a defined way of, they know, hey, listen, we're going to get that. We're going to call them back. We're going to say, hey, we got your complaint. We're going to look into it. And you're going to look into it and you're going to engage whoever was involved. And then you're going to, come together and say, hey, what's our best approach at following up with this person? Follow them up and be transparent. So I think things like that. And then also, how are you going to finance your risks? So taking a look at what your insurance coverage looks like. I was talking to somebody yesterday who was carrying insurance coverage for employee benefits liability, but they had no employees. So I think just, there's opportunities where, kind of reviewing what your risks are and whether or not they're adequately covered. Cyber's a big one nowadays too, especially as people move into using AI. So making sure that you have enough cyber coverage liability, depending on the documentation system you use, how often you use it, and what your volume looks like in your clinic. So you could be overpaying, or you could be uncovered in certain areas.
But if you don't ask and you don't look into it, you have no idea.
Yeah, I think from the big risk, perspective, you want to look at all aspects of your business. And I think for me, when I first tried to go and do my own thing there, and didn't really persist with it enough to be successful, all that stuff was so intimidating for me.
Sure.
Like, is it liability? Do I need insurance? How much do I need? What do I do? Do I need informed consent or release of information? Like, all of those things were very intimidating for me. And now that I work in it, I feel like it could be helpful for some business owners.
Are you still staying late just to finish your notes? Aphelis Scribe uses ambient AI to auto-generate documentation, so your notes are done before you leave the room. You want to see how it works? Email me now at jimmy@ptpintcast.com. I'll give you a quick demo. Yeah, that's good insight. Let's talk about AI. If someone's not assuming that their colleagues, their clients, their employees are using it in some way, shape, or form, I think they're being naive. You said it's both a massive risk and massive opportunity. Sounds like something powerful. What do clinic owners in general need to know or be thinking about artificial intelligence here from the angle and perspective of risk?
You've got to assume that your patients are going to be, pumping in their symptoms into the AI, into whatever, AI they're using. And let's think about it from this end, right? Like primary care. I mean, your patient, you as a consumer, as a patient, can pretty much put all your symptoms in, and it's going to tell you, relatively what you should anticipate in terms of potential diagnoses or even just the tests or the next steps. So I think, from the therapy perspective, we can anticipate that, having access to the knowledge is going to be everywhere. Where I think that PT stands to gain the most from this is I think people will be yearning for authenticity. So information is not going to be an issue. Anyone is going to be able to get any information they want within 10 seconds anywhere. But I think there's going to be a real appetite for who can deliver that information in an authentic way and from a source that they can trust. The biggest opportunity I think for PT is the manual therapy. I mean, 5 years from now, like I said, information is going to be everywhere. But somebody who you really trust is really good with their hands and has a good skill, a real niche skill. I mean, that may be at such a premium. Who knows how much that's going to be charging for a half an hour session of really good manual therapy?
Sure. Yeah. Understanding it. What about people using off the shelf artificial intelligence in a situation where there are these AI scribes out there, right? But why pay for it? I've already got my free or low cost ChatGPT subscription. Why not just use that? If you heard about someone doing that, when Mike's sitting there from a risk perspective, what are the different things that could go sideways or wrong?
Yeah, right. It's probably endless because there's just so much you don't know. And I really would hope that people aren't pumping in patient information into AI that,
Why?
well, you've got HIPAA, you've got violation risks, right? So you have a simple, I know I say simple because they tend to be, prevalent nowadays, but you have a data breach. And I mean, that can be catastrophic, and it's likely that you're not going to have enough insurance coverage. Or if you do, it's extremely expensive to have cyber liability coverage that's going to extend. If you've got, and from the risk perspective, this is something as a business owner, you really want to have some kind of policy at your clinic level, even if your clinic is 2 people, where it says that, it essentially mandates that you're not using or putting patient information into anything that's not authorized by the clinic owner. So these are privacy risks, right? You're putting in information that's patient information, and in the presence of a breach, it could be very problematic.
Yeah. You said a few minutes ago, shameless plug, that you've got something. If I ask you to talk about it, it's not shameless anymore, Mike. So I want you to talk
Sure.
about that resource. What is it? Who would it be good for? And what do they get out of it?
Sure. Yeah. Essentially a risk assessment. So you go in. It's not complete. Probably take another 10 days or so. But I'm hoping by June 1st. But essentially, a business owner pumps in a self-assessment that will give you a score that says you have risk in certain areas. So you're walking through how big it gets down to how big is your clinic? What services do you provide? Because the services that you provide really alter kind of what your risk status is. So the services that you provide, how big you are, do you have certain policies in place? If you're doing pelvic health, a chaperone policy, the opportunity for someone to have a witness who's in the room with them. I mean, this is really big in the risk financing world right now. So I think at the very least, every clinic should be exploring that. But yes, a step-by-step walkthrough that outlines where your biggest risks are, so you know where to focus your time and energy, and whether or not you need financing, or at least a conversation potentially with your broker.
That's
I don't
great.
sell insurance or anything like that.
How's someone going to get that guide? Where would you send them?
Sure, they can go to my website, which is Rehab Risk Consulting LLC.com. But really, I think you send me an email and I'll send it to you for free. I essentially have 2 different versions. We'll have finalized 2 different versions of one real more comprehensive one where I'll offer a follow-up, and there'll be a cost associated with that. But more of one if you just want to get a quick peek at where you think your risks are in your business. It's MUZAR at rehabriskconsultingllc.com.
Perfect. Mike, last time we do on the show is called The Parting Shot. It's your last chance for a mic drop moment, a soapbox statement. What would you leave with people as we wrap up?
Well, if we're talking to physical therapy business owners, I would say don't run from things that go wrong. I really think communication ends up being the cornerstone of everything that goes wrong almost. I mean, having an appropriate communication with what the expectations are, and when things don't go right, immediately intervening with a step-by-step process of what you're going to do in terms of engaging with that patient. The reputational impact, I think, is tremendous, especially when we talk about how people live in the community. People aren't driving, an hour to their PT sessions 3 times a week. They're usually right down the street from them. So the word of mouth impact is big. So treat those adverse outcomes and complaints as opportunities.
Well said, Mike. Appreciate the time. Thanks for doing what you do. Like seeing a PT in this role too. I think that's pretty non-traditional. Is making sure other people see that you can step outside of a traditional role with a DPT degree and use it in different ways. So thanks for telling your story and sharing that, Mike.
Thank you so much. This is great.
Like what you heard? Great. Subscribe to the show on Apple or Spotify. You can watch the episodes on YouTube. Or don't. I'm not your boss. You want to specialize in ortho, neuro, or sports physical therapy and actually get paid while doing it? Brooks IHL offers accredited residencies and fellowships with full salary, full benefits, and real mentorship from clinical experts. Learn more and apply at brooksihl.org. There aren't nearly enough podcasts in this world. Said no one. Why not launch one more? If you thought about launching a show but don't quite know how, we can help you do all that back-end stuff. Email me at jimmy@ptpintcast.com and we can add one more podcast no one else will listen to the pile.